Hey guys, Dr. Angelina here. So I was asked to read a book and videotape it. For those who follow me on TikTok, Dr. Angelina MD, you can follow me there. For those who are on TikTok now, you can follow me on IBI Healthcare Institute channel where we are live right now. And I'll leave this recording up for my patients to listen to. And that's because you guys asked me to read the book for you. It's a little brochure book. I said that I will have my patients read the book before coming to the office for further conversation about hormone replacement therapy. And for all of you on currently TikTok, you can always head over to YouTube where I'm currently located. So you guys asked me to read the book, so we're gonna read the book. I'm gonna skip the author's forward address. We're gonna stick straight to the hormones and other parts of the book. So it talks about hormones, biologically identical hormones, so bioidentical hormones that we talk about, hormone replacement therapy and aging, thyroid hormone, estrogen, progesterone. Then there's a chapter called To Bleed or Not to Bleed. That's for those people who, tend to bleed. Testosterone for men, testosterone for women, DHEA, melatonin, and then there'll be summary. So this book is written by one of the doctors that treats and teaches a lot of conferences about hormones, Dr. Neil Rouzier. He has a bigger book, like a real book too. This is something he recommends to give to his patients, and I said I'm going to do the same thing. I'm going to take his book, give it to my patients. That way patients are better educated. If patients are better educated, they can help themselves better. So, and you guys, I am streaming live on YouTube, so if you want to come over there, you can. So, for YouTube people, hi. Follow, click like button, follow, and subscribe. All right, hormones. Hormones are molecules that are synthesized and secreted by specialized cells, often located in endocrine glands. We have endocrine system in our body, and there are multiple different cells and different organs that part of endocrine system. Hormones are released into the bloodstream and exert biochemical effects on target cells. So basically, our hormones are like little messengers. Our brain tells the endocrine gland to make a hormone. The hormone goes inside a certain type of cell to tell the cell what to do. I hope that makes sense. Hormone action is determined by the presence of specific hormone receptors located either on the cell surface or intracellularly in the target cell. So again, hormone has to go onto the receptor. Something has to receive that hormone to understand the message. And it's either inside the cell or outside the cell. Hormones turn on the cellular machinery and therefore cause increased metabolism, increase in protein synthesis, increase in cellular repair, and increase in cell replication. All aspects of aging are influenced by hormones. As we age, cellular receptor sites become less sensitive to stimulation by hormones, thus requiring an increased amount of hormone to effect a cellular change. Place where you're going to be more familiar with this kind of concept will be your diabetes and insulin resistance. At some point, your body just does not respond to insulin the same way it used to for whatever reason, whether it's genetic, whether it's diet, environmental, whatever, and you require more and more levels of insulin to get the same change. So that's where we see that similar concept, but you can apply this concept to any hormone and any tissue. This is precisely why people need optimal levels of hormones. And even though their levels might be normal, they still need more hormone in the body to improve and feel better. This is particularly true with thyroid. These changes in hormones result in decreased healing and repair of tissues. Research has now proven that hormone therapies are valid means to improve and prolong quality of life, thus showing that deficiencies in hormones and endocrine dysfunction can contribute to the signs and symptoms of getting old. He says, sorry, nothing reverses aging, unfortunate, even though right now we know there was a study that came out that shows Ozempic may be anti-aging. However, hormones can slow down the process and help us maintain our good health. So like we're aging, but we don't hurt as much, right? We're aging, but maybe we don't wrinkle as much and we're not as miserable. True reversal of aging requires identification of genetic loci that controls the aging process and the manipulation of these genes by genetic engineering techniques. So we don't have the engineering in genetics to that degree yet. Maybe one day they'll figure it out and they can fix us permanently with genetic engineering. We don't have that. Unfortunately, technology to accomplish this age reversal by genetic engineering is not currently available. In the meantime, we think we can take advantage of the current state-of-art preventative medicine techniques, which include avoidance of risk factors of disease, optimal nutrition, adequate exercise, caloric restriction, antioxidant therapy, and optimal hormone replacement. We can certainly slow down that aging process to achieve less deterioration, less illness, a better quality of life, and to feel and function better. This is true preventative medicine. So, yay, chapter 1. Who wants me to go on? Do you want me to make a whole bunch of little videos? Do you want me to make one long video? Because you guys said you want to listen to it before you go to sleep, so that when you come to my office, you know what the hell I'm talking about. You started getting age spot. Well, watch me. I'll be doing my laser on my face soon for the age spot. You guys make sure you follow. Currently, I am live streaming on YouTube, IBI Healthcare channel. It is linked in my profile. If you are on YouTube, go ahead and press the follow button and subscribe button and like this video. All right. What is biologically identical hormone? We'll do a couple chapters in this video and then I'll make a series out of it. That way it's easy for you guys to listen. So why am I talking about it while I'm a surgeon? Because I'm tired of operating on old people. I want my old people to feel better. I want my old people not to hurt. I'm getting there myself. I don't want to hurt either. So as I told my followers on TikTok before, I have started my own hormone replacement therapy a couple weeks ago. So I'm in the process of, balancing that out. It's going to take some time, but I'll obviously be doing the same thing for my patients. So this is a requirement to read before starting hormone replacement therapy because I want you to understand what you are doing to your body. All right, biological identical hormones. You might ask if there are hormones available that are natural to my body, why do doctors prescribe synthetic hormones? The explanation involves the powerful pharmaceutical industry in the United States, politics, and economics. Surprise. Are you surprised? Are you surprised? The molecule of the natural hormone is identical in structure to the hormone naturally found in the body. Pharmaceutical companies cannot patent natural or bioidentical compounds because they didn't invent them. We invented them, our bodies invented them. However, they can patent chemically different molecules that are highly profitable. A patent will guarantee that pharmaceutical company will have an executive right or exclusive right to manufacture and profit from their product. After the tremendous monetary investment that goes into developing and studying a pharmaceutical product, it is logical that the pharmaceutical companies would want their investment protected with an exclusive patented product. Therefore, there is little research and minimal marketing of natural hormones. A large part of marketing a drug involves the education and instruction of a physician on how and when to prescribe it. Much of what physicians know about drugs comes directly from pharmaceutical companies promoting a product. Because pharmaceutical companies don't manipulate natural hormones, most physicians do not learn about them unless they do personal research. You guys understand what that means, right? Where do these natural hormones come from? The pure biologically identical, human identical hormones is either extracted from plants or synthetically manufactured. What is most important is that the end product is a molecule identical to the hormone molecule found naturally in the body. This applies to all hormones: thyroid, estrogen, progesterone, testosterone, and DHEA. Those are just some of the hormones we produce naturally. Where does one fill prescriptions for natural hormones? There is a special type of pharmacy known as compounding pharmacy. Now, there are some bioidentical hormones that are available in regular pharmacies as well. Um, my practice will deal with compounding pharmacy just because that's our style of practice. But some of the doctors who are well versed in it will be able to find it in regular pharmacy as well. These are regular licensed pharmacies, the compounding ones, that are capable of providing you with any drug from pharmaceutical companies. But compounding pharmacies are able to do more. So the compounding pharmacist is similar to old-fashioned concept of pharmacies with mortar and pestle. So basically, compounding pharmacists can really formulate medication based on what we want. So right now, for example, and we'll get into it later again, but all the societies like menopause societies say, oh, it's okay to give testosterone to a female, replacement testosterone, because we naturally have it and it declines after menopause. So it's okay to give testosterone to a female, but you have to give them 1/10 the amount that's available, because it's only available for a male. They actually know, testosterone formulation like that available from regular pharmaceutical companies. So they say, yeah, it's okay to give it, but it's only produced in a regular like a regular pharma, that you can buy in regular pharmacy, only available for a male, but the male dose is too much for a female, you have to give them 1/10 of that. Why not just produce directly for a female? But it's not being done. So that's where compounding pharmacies are very useful. I can give one dose to a male and an appropriate female dose for a female without trying to cut up the male dose into 10 parts. That's where compounding pharmacy is really helpful. So, the compounding pharmacy is similar, we're talking blah, blah, blah. They acquire the pure pharmaceutical grade hormone and compound it into the dose and form ordered by physician. They produce pills, capsules, liquids, and creams, per the doctor prescription ordered for you. This makes your program very customized and personalized. Aren't health foods store what? Oh, they're asking like, aren't health food store products natural? Products in health food stores provide people with a variety of natural options, usually with herbs or plant source. Folk medicine, naturopathy, and herbalists have become more popular as people seek alternatives, I cannot say those words, to conventional synthetic medicines. However, the products from compounding pharmacies are different in several ways. First, the medicine provided by a pharmacy requires prescription. Health food store products are most often of a dose that is low and does not require prescription. Usually the dose is so small in the health food stores that it's insufficient to produce measurable difference in the body based on laboratory tests. Second, the products from compounding pharmacy utilize ingredients of a pure pharmaceutical grade that are micronized. Micronization of this product will be one of the keys to this product. Micronized means that the product is a fine grain that will be well absorbed. Third, the natural hormones from the compounding pharmacies can be prescribed as a long-acting or time release. This helps the body have a better balanced hormone level instead of highs and lows that come with other products, right? We don't want the up level, down level, up level, down level. 1 minute you're feeling fine, next minute you're having hot flashes and going crazy. We don't want that. We want to stabilize the levels, right? Are you guys with me yet? The 40 of you still up there, that's good. And again, IBI Healthcare Institute YouTube channel, it is linked in my profile here in TikTok, and make sure you subscribe here, IBI Healthcare Institute channel. All right. Compounding pharmacy is able to customize an individual prescription and provide several options for personalized hormone program. This ranges from individualized doses to custom fillers, for example, lactose-free, to options of delivery, sublingual tablets, capsules, liquids, and creams. In order to assure adequate replacement, hormone levels are monitored and then adjusted to maintain optimal levels of all hormones. HRT might be worthless unless monitoring and adjusting the dose is done. Like, you have to monitor, make sure that what you're doing is actually making sense and working. To summarize, a bioidentical hormone has a chemical structure that is identical to hormone naturally produced by the body. We refer to them as natural because they are natural to the human body. Natural hormones cannot be patented by drug companies. Synthetic hormones have a structure similar but not identical to what we produce in our body. These chemical differences mean that the synthetic hormone acts differently and produces substantially different effects. Natural, bioidentical, and synthetic hormones should not be considered the same or used interchangeably. So if somebody doing a clinical trial on a synthetic hormone, we cannot and should not apply results of a synthetic hormone to the natural hormone because they're not the same. A multitude of studies have demonstrated many harmful effects of synthetic hormones, where the medical literature supports no harmful effects of natural hormones, only beneficial effects. Let it sink in. So that basically happens because, and why it's important going forward, because some of the doctors you're gonna go to gonna say, I don't believe in hormones, which is crazy because we all make hormones and we'll have hormones, and that's what makes our body function. And you see doctors, and I hear it all the time, hormones cause cancer. Again, there is no proof of that with bioidentical hormones. There's really very little proof of that even with synthetic hormones. Even in a clinical trial that everybody trying to quote to say that trial showed cancer, when they looked back at it and re-evaluated the data of that trial that was not done correctly and gave us bad data, even in that trial, those hormones showed some protective effect. So we really need to understand how to read the data, and of course we cannot make everybody do that. That's not your job. But we need to get doctors who are open to reading new data, who are open to treating people, and that means having discussions about those things. Because what will happen, like it is happening right now with Ozempic, everybody blames Ozempic for everything. Oh, my auntie died of colon cancer, it must be Ozempic. Oh, somebody had bowel obstruction, it must be Ozempic. Somebody else had something, pancreatitis, pancreatic cancer, it must be Ozempic. Well, no, it wasn't. It was the use of the medication that was wrong. Or person already had cancer because it takes 10 years to develop. Ozempic haven't been around that long. Same thing will happen with bioidentical hormones. You will always get a doctor or a person who's going to blame whatever it is they got on the hormone. So if the old studies showed that somebody could have a stroke or blood clot while on the hormone, then if somebody gets a stroke or blood clot while on a hormone, they're going to blame the hormone, even though this hormone is completely different from the one that was studied. This is not the same hormones. This hormone's never shown any side effect of such. Actually, it shows reversal of cardiovascular disease in females and prevention of cardiovascular disease in the female. It does not mean that there be no females with heart attacks anymore. It just means some of them still get heart attack. Maybe not die as often. But if a female gets a heart attack while she's on hormone replacement therapy, there'll be some who are going to try to say it's hormone related, when it's not true. But people are always going to try to blame something for something bad, right? We always need that excuse. We always need that something to grab onto if something bad happens to us, right? It's just our nature. We always want to find a reason for it. And sometimes there's no reason. Sometimes it's just genetics. So anyways, this is the beginning of reading of our book for bioidentical hormone replacement. This is by Dr. Neil Rosier. I make my patients read the book before we started the therapy. And so I will do further reading as time progresses, and I will post it on YouTube again. So we'll make 20 little minute videos about the hormones, and you guys can listen to it because I know you will not read the book if I don't force it on you, and I want you to read the book. I hope that helps.